And we are live. It is December 7th, 2020. What a miserable year this has been. And in celebration of the remembrance of Pearl Harbor Day, I just thought I'd play something real quick. Hopefully you can hear this. It's an excellent little piece. Listen.
Tag that drew America into World War II happened 75 years ago today. Alex Dimitrick reports on Baltimore's remembrance of Pearl Harbor.
The Coast Guard cutter Taney is a floating museum today. Right. But every December 7th, it becomes Baltimore's touchstone to Pearl Harbor and the Japanese attack 75 years ago.
Yesterday, December 7th, 1941, a date which will live in infamy.
The Taney is the last ship in that attack that is still afloat. A few of her old crew who came aboard later in the war remember a well-run ship.
Oh, you bet it was. I enjoyed every minute of it.
Beverly Blessing still wears her late husband's dog tag. He decided to stay aboard during the Battle of Okinawa rather than go ashore for an emergency appendectomy.
The kamikaze ray came over, and George had to go off the table by himself and go to a secure place, not knowing that decision would save his life. The hospital on land got a direct hit.
In the attack that began the war, there were a lot of direct hits.
The 2,403 who gave their lives 75 years ago today at Pearl Harbor.
The kind of shock that followed that attack would not be felt again until September 11th.
That's when we lost our innocence that day, about a surprise attack.
Those lost remembered with full honors. Alex Dimitrick, WJZ Eyewitness News.
The Coast Guard cutter Tani remained in service until its decommissioning on December 7th, 1986.
All right, good information. 75 years ago. All right, I want to talk to you a little bit about how are older adults coping with the mental health effects of COVID-19? How are you handling the mental health effects of COVID-19? Turn this camera a little bit. And we're also going to talk about those bleach alternative disinfections that you're using in your house. Just a little heads up on that front too. So 2 quick studies that I think are very important. Older adults are especially vulnerable to the effects of the COVID-19 pandemic, not only in catching it, with higher risk of severe complications and death, and potentially greater difficulties accessing care and adapting to technologies such as telemedicine. Just can't get that. A Viewpoint article published in the Journal of the American Medical Association notes that there's also a concern that isolation during the pandemic could be more difficult for older individuals, which could exacerbate existing mental health conditions. Information gathered over the past several months suggests a more nuanced picture, however. You know, back in May, we lost my father-in-law, who went into the hospital for cardiovascular complications. And upon discharge, I remember talking to the discharge physician who had said to me, why don't you put him into hospice care? His heart's really bad. Let him be comfortable. Let him live at home with his wife of 70 plus years. Let him spend his last days in comfort. But other family members didn't want to do that. They decided to put him into rehab, where he ended up coming down with COVID-19 and spent the last weeks of his life in isolation. And what I saw happen as far as the mental health issues involved there was hideous. And I'm going to say that the mental health issues ended up killing him. More than COVID and more than the cardiovascular disease. This article goes on to say, over the spring and summer of 2020, we were struck by a number of individual studies from all over the world that reported a consistent theme. Older adults as a group appeared to be withstanding the strain on mental health from the pandemic better than anybody else. Better than me and you. Said lead author Dr. Vahia MD, Medical Director of the Geriatric Psychiatry Outpatient Services at McLean Hospital. In this article, we highlight some of those studies and discuss resilience in older adults and what factors may be driving it. So yes, the older adults may be more susceptible to catching this thing. And yes, if they do catch it, they are more susceptible. But the isolation thing, they seem to have dealt with this a lot better. Resilience may reflect an interaction among internal factors such as an individual's stress response, cognitive capacity, personality traits, and physical health, and external resources like social connections and financial stability. For older adults experiencing isolation during the pandemic, having more meaningful relationships seemed to be more important than having more interactions with others. Do I have to say that again? That if mom and dad are home on their own now, and we're going through phase 2, 3, or 4, whatever this is, and they're starting the lockdown again. Remember what this said. Meaningful relationships were more important than having to see somebody each and every day. Have you kept in touch with mom and dad, or grandma and grandpa? Resilience can be supported through increased physical activity, enhanced compassion, and emotional regulation, and greater social connectivity. The author stressed that although the findings from the early months of the pandemic are encouraging and provide cause for cautious optimism, older adults are a highly diverse group. Each person's response to the stresses of the pandemic depend on a unique set of circumstances, but they handled it better than us. Now, did you wait in line to go and buy all those bleach alternatives because you bought into what Fauci said, that this thing lives on inanimate objects? Notice you haven't heard that anymore. Why? Because it doesn't. Period. University of Saskatchewan. Cleaning surfaces with hydrogen peroxide-based disinfectants has the potential to pollute the air and pose a health risk. According to research led by the University of Saskatchewan, the research team found that mopping a floor with commercially available hydrogen peroxide-based disinfectants raised the level of airborne hydrogen peroxide to more than 600 parts per billion, about 60% of the maximum level permitted for exposure over 8 hours, 600 times the level naturally occurring in the air. The results are published in the Journal of Environmental Science and Technology. When you're washing surfaces, you're also changing the air that you breathe, said chemistry researcher Tara Cahan. She said poor indoor air quality is associated with respiratory issues such as asthma, which could make your chances of catching COVID even greater. Too much exposure to hydrogen peroxide could lead to respiratory, skin, and eye irritation, according to the U.S. Centers for Disease Control. The COVID-19 pandemic has led to increased cleaning and demand for all kinds of cleaning products, including bleach alternatives that contain hydrogen peroxide. At the beginning of the pandemic, we couldn't do research on this topic because hydrogen peroxide solutions were out of stock. But we, not me, we, the Faucis of the world, told you stay away from bleach and go to hydrogen peroxide. You know, those idiots. Cahan's team, which also included researchers from Syracuse University, York University, University of York in England, sprayed the vinyl floor in a simulated room environment with 0.88% hydrogen peroxide and wiped it dry with paper towels, either immediately or after letting it soak in for an hour. The team then tested the air at human head height. The real risk is for people who get repeatedly exposed, such as janitors or house cleaners. We washed the floor and collected measurements at face height. Concentrations will have been stronger at the floor or the level of a countertop. Cahan said the impact on children and pets, those physically closer to the disinfected surfaces, is not yet known. More than 10% of the disinfectants approved by Health Canada that are deemed likely to be effective against SARS use hydrogen peroxide as the active ingredient. A total of 168 disinfecting products contain hydrogen peroxide as the active ingredient. There are a few ways to reduce the risks while disinfecting your home. Number one, consider using soap and water. There's a unique idea. Soap and water is known to kill the virus that causes COVID. There's a unique idea. Consider opening a window or turning on the range hood or using a central air system. Opt for hydrogen peroxide-based disinfectants over bleach. They said hydrogen peroxide is still much less potentially harmful than bleach. So there. Tomorrow on the show, I'm going to get involved in another piece about anticoagulant treatment. You may say, well, what are you saying about this? Well, it's gotten to be a staple of care if somebody gets rushed into the hospital. Put you on anticoagulants, Eliquis, those kind of things, because of the risk factors of blood clots. It seemed to run with COVID. So we'll get into that tomorrow. Please share this with others, would you please? The number to reach us at the office, 678-228-8900, 678-228-8900. The website, thenutritionshop.net. God bless you, folks. See you back here tomorrow. Take care.